Thank you, Tim, and good morning, everyone. While each of us gathered here today, the representatives behind me hold deep concerns over the moral and ethical implications of government-controlled health care, an issue that frankly deserves its own press conference. As a senior member of the House Appropriations Committee and as the subcommittee chairman on fiscal policy, it is my belief that Medicaid expansion will cripple our state's budget and our finances over the next 7 to 10 years. As an elected official who interacts with the public regularly on policy matters, I will acknowledge that roughly 50% of the public is okay with Obamacare. We just came through a national election and we saw those numbers bear out. And they embrace, that public, 50% embraces some level of government takeover of our doctors' offices and our hospitals. Support runs to 50% so long as Obamacare is free. Where this Democratic Party agenda point runs into a brick wall is when you start proposing that Harrisburg pass tax increases to pay for it. I've noted with some interest that Representative Dan Frankel, the House Democratic Caucus Chairman, has launched an effort to push for Medicaid expansion. And while I consider Dan a friend, I must note that there is one thing missing from his push: a corresponding tax hike to pay for this part of Obamacare. I'm sure that's just a temporary oversight on Dan's part, and that the second half of the Frankel plan will be coming forward shortly. So where are we headed if we add 650,000 to 800,000 new people to the rolls of Medicaid? As we know, there is some level of federal support in the early years. Administrative costs in the early years are pegged at around $300 million, a number which our Democratic friends brush off as insignificant, which is helpful because I'm sure that public school advocates, higher education lobbyists, and our state employee unions will gladly reduce their piece of the state budget pie to help support Medicaid expansion. But then we get into the dreaded out years, those years when federal assistance dries up and Pennsylvanians are left to foot the bill. Costs will escalate in such a manner that rough estimates place the cost of this expansion in the neighborhood of $2.6 billion over the next 8 years. That cost level will leave future assemblies with two horrible choices: raise taxes through the roof to cover the difference, or start gutting current government programs. I've served here for almost 10 years, and one thing I can tell you to hang your hat on is that there are not 102 votes on the floor of the Pennsylvania State House to support an Obamacare tax hike. Further, I cannot envision a time when a majority of our citizens are going to support politicians who raise their taxes to pay for this mess. As representatives, we've all heard from the Hospital Association of PA advocating for this change as a way to transfer the cost of uncompensated care from their ledgers over onto the backs of the taxpayer. And I totally get that they are advocating for their respective hospitals. Unfortunately, our budget is already strapped, and beyond tax hikes, we get into a game of budgetary winners and losers. HAP has not to this point suggested whose ox should be gored. Friends, here in Harrisburg, we speak of millions and billions and impacts and agendas. But who should really be deeply concerned about this direction? If you're a parent who has small children who are entering their school years, we're here to tell you that this move toward Medicaid expansion is going to severely impact education subsidies coming from Harrisburg to our school districts. And those concerned about property taxes should be particularly concerned because short of us funding, it falls to the local level. Beyond that, if you're a parent of a special needs child and you appreciate the social service network that we send out here in Harrisburg to help support your difficult situation, social service budgets are going to be impacted deeply by this new expansion, the Medicaid expansion. Those are just two impacted groups of citizens in our state, but you look at every line item in our budget, every category of spending, there are going to be deep impacts coming if we expand Medicaid rolls in the way that we're talking about. For these reasons and more, we call on Governor Corbett to say no to Medicaid expansion, and in fact, in your press packets, you'll see that 38 House Republicans have signed a letter to the governor indicating opposition to Medicaid expansion. Thank you, friends, for your time and your consideration. At this point, I'll turn the podium over to Representative Cutler.